Welcome back to Atlanta, Chicago. Well, following the numbers when it comes to COVID-19 in Illinois, the top 5 zip codes with the highest number of cases are all dense Latino neighborhoods, places like Little Village and Cicero. Joining us now to try and understand these numbers is Geraldine Luna. She's with the Chicago Department of Public Health doing some outreach in the Latino community. Thank you for joining us, Geraldine. How are you?
Good. Thank you for having me, and appreciate your giving me this opportunity.
Yeah, no, I think it's a wonderful conversation to have because hopefully people will learn from it and take this back into their neighborhood. So let's just start with the numbers and the trends that you're seeing in our Latino neighborhoods. I mentioned places like Cicero and Little Village, but not too far behind those, Brighton Park, McKinley Park, Belmont Cragen neighborhood, all dense Latino neighborhoods seeing this rise in COVID numbers and COVID cases. Is that what you guys are noticing? What are the trends that the Chicago Department of Public Health is watching?
Unfortunately, it is. Since last month, we're always comparing last month, and we're always comparing how it looks now that we are in the middle of the surge. And we went from less than 5% positive rates. It was like 4.3, and we're talking about 5 weeks ago, maybe 6 weeks ago. And now we're skyrocketing to 15.5, last I checked on our dashboard. And that is terrible. Last week, the mayor was mentioning that 1 in every 15 individuals had COVID. And in 18, I'm sorry. And now it comes down, it's closing. The numbers are closing on us. And now 1 in every 15 individuals, it's positive for COVID. So these are alarming numbers. This is something that we really have to act upon. And the city and the Department of Public Health has recognized the emergency of this situation, these incrementing, skyrocketing numbers, and they have launched Protect Chicago.
And the numbers that you speak about is not just, citywide, but specific to these Latino neighborhoods as well. So talk to me about that.
Yes, as the beginning of this pandemic, unfortunately, Latinos have been more disproportionately affected by this disease, and there's different theories. We think that it might be because of the fact that we're essential workers, and we still sustain that point that might be the case, that we're in the front of the healthcare field, we're on farming, we are restaurants, we're serving. And we do what we do best, but it comes with a price, and we're suffering the highest cases, and we can see that now in emergency rooms. We can see the hospitalizations had increased 3 to 4 times what we used to have 1 month ago. So these are very poor news. It's not looking good, and we really need to take action. We really need to put this disease into control.
And I know that the Chicago Department of Public Health has really done a lot to get the message out to some of these neighborhoods. What's happening right now? Like, are just people in Latino neighborhoods not wearing masks? They're just living too closely together? I mean, you would think by now we would have gotten the message, but somehow that's not happening. So what more can be done, right?
Exactly. We initially, we had these numbers spiking in May. It started in March and it went very high on May. But we did kind of like master it. We curved that trends that we were having, skyrocketing, and we went to very positive numbers. We started reopening, but it's clear that COVID thrives in the cold weather. So there are various theories here. It's as we suspected. Scientists have been saying, CDC from Dr. Fauci has been saying all along that we should have been prepared, as we did, preparing for a second surge and probably a third surge. Hopefully that we never see that third surge. But I think the department and the city is seeing a lot of what we called this COVID fatigue. It could be like the anxiety related to it. It's just that we're run down by all the things that are happening around us, seeing everybody getting sick, living to the edge. And it does bring this attitude that you kind of like numb yourself. You don't care anymore. And then you're not practicing your social distancing and you're not wearing your masks and you're lowering the guard around the people that you feel comfortable with, the people that you trust. And that's why we see that these infectious cases and these outbreaks occur 2 of 3 times at home, where you're surrounded by people that you trust, trusted faces, and you feel comfortable. Yeah. So that's the alarming thing about it. And that's why one of the reasons that we're highly recommending, don't bring guests home, even if it's your own family, at least for this year, because we have to put everything together. Protect Chicago is a campaign that is strongly encouraging people to stay at home. Don't leave your house unless it's an essential thing that you need to do, like working, go to school, go out to do your essential shoppings. But if you can avoid all of that and you can stay at home, this is the time, because the numbers have been rising to levels that we never had them before.
And they're rising so quickly. Yeah, and they're rising so quickly. You'll look one day and then the next day it's, you know, the numbers are up by a couple hundred just in a certain zip code or a certain area. So it is going very quickly. I want to add that in the Latino community, there's sort of this added layer of difficulty, and that is language. Where oftentimes the messages are coming at us in English, and perhaps you've got somebody or a couple people in your home that don't speak English. They may only be able to communicate in Spanish. What types of resources are there out there from the Chicago Department of Public Health to make sure that we get that message out in Spanish? What's being done?
Well, I can't put anything better into the forefront than our recent campaign of Protect Chicago. It launched in Belmont Cragen, and we're doing everything the old way, like door to door, the game ground, like knocking on doors, boots on ground, trying to level any inequalities that we have in people getting the information. Not everybody has phone. Not everybody is good with technology. Not everyone has a TV set to see the news or to keep updated. And then it doesn't come, as you mentioned, it's not coming with the language and cultural concordancy that it should. So sometimes that creates disparity, and we're seeing it now. Have we the same way that we have seen it in the past? So for now, like, this campaign looks at trusted faces, people that know you, that speak like you, that look like you, knocking on your door and leaving the information, and that is amazing. That's very powerful. And having now representation of the Latino in the department at different levels and communications, they're doing it. And myself, now I'm the medical director for the COVID-19 Response Bureau. So I'm there putting a voice, and we're working in direct communication and close contact with those partners out there embedded in the community, the people that serve our population of Latino and their trusted faces and voices. And I think this is something that is a reach that we haven't taken before in the pandemic, but we're aiming very strongly to do that. And the department is working hand in hand in collaborations with our partners.
I can't let you go without talking to you about the vaccine and a vaccine coming our way in the next, hopefully, in the next few months. What will the outreach be like in the Latino community? Are you expecting that maybe a bulk of the people will be hesitant to take that vaccine or to sign up for it?
We have heard a couple of things already. Like some people think it's pretty rushed. Other people think it's, oh my God, hooray, this is the time for it. So we might see mixed reactions, and the important thing is education. Well, as anything else, you need to understand side effects, the extent, how many doses do I need, where do I get these vaccinations, and all that information, we're imparting that, and it's coming more and more. As you remember last week, the commissioner with the medical director of communicable diseases was mentioning that the vaccines is out there already. We're still on the FDA phase, but it's closing now. It's sooner than it's sooner than it was before. So I see that as a light of hope.
Okay.
And I'm sure that the majority of us Latino will take advantage and vaccinate because
We'll
this is
be
something.
watching it, Geraldine. We'll be
Yes.
watching it. Geraldine Luna joining us today with the Chicago Department of Public Health. We appreciate your time. Good luck to you.